friends, agents, producers, people who want to be producers across the country. We're talking Medicare supplements today. All right, so we've been telling this story, and as you've watched our videos, we talk about Medicare and how it's a core product of what we offer. Again, remember, it's health, wealth, and life insurance. Medicare is your health portion. It's a core part of what we do. Nobody understands Medicare, and if you can understand Medicare supplements, it's such a big part of what we're doing. You're going to be able to make so many more connections. You're going to make so many more sales. So understand Medicare supplements. We're going to jump in today, talk about this important product. We're going to talk about some important concepts as well. So let's talk about a senior's options. So, you know, we've been telling the story. We're telling a story here about Medicare. So let's talk about their options. They really have three options. They can stay on original Medicare. They can have a Medicare supplement or a Medicare Advantage. But let's talk really why there's only two real options they can have that make sense: a Medicare supplement or a Medicare Advantage. And I'll tell you why. You need to understand this, guys, that if someone has original Medicare covers 80% of the cost. So Part A, hospital, Part B, doctor, cover together 80%. And what I do for so many seniors and when I'm training agents is I draw a pie. And I want you guys to draw a pie too, with a 20% slice taken out of it. That represents original Medicare. Let me ask you a question. Why would someone not want to have original Medicare? Because if the bill came to $100,000 and Part A and B together cover 80%, that's reflected in your pie, what happens to your client? They have to pay the 20% cost that original Medicare doesn't cover. So to make this so simple, a Medicare supplement, it fills in that 20% slice or that 20% gap. Medicare supplements are also called Medigap policies. So when you see someone on original Medicare, maybe they have a little bit of income, put them into a Medicare supplement to cover that gap. That's the basis of a Medicare supplement. All it does is it covers the 20% gap that original Medicare doesn't cover. And it's a great product. We're going to talk about that, talk in more detail about this product, how you sell it, the benefits, so you really understand what to do when you're in the house. As we discussed, you drew your little pie, where I tell people to draw Pac-Man. Original Medicare covers 80% of your client's costs. Original Medicare is A and B. It covers 80%, so your client is left with a 20% out of pocket. The bill comes to $100,000, they have to pay $20,000. The bill comes to $1 million. We've had situations where you see these massive bills, like for a triple bypass surgery, or we've seen situations where people are burn victims, or crazy cancers. Those bills are through the roof, right? So if they had original Medicare that only covered 80%, they'd be left with the 20% out of pocket. That's crazy. A Medicare supplement will cover that cost. I tell the story to so many people. My aunt, I enrolled her in a Medicare supplement. She had both knees replaced. She had original Medicare and a Medicare supplement. It covered the whole thing. She had so little out of pocket. So Medicare supplements are great because they cover that 20% out of pocket. I framed this a little bit before, but what is a Medicare supplement? A Medicare supplement, otherwise known as a Medigap plan, covers the 20% exposure or gaps in coverage in original Medicare. Medicare beneficiaries must have Part A and B. So everyone we sit down with, we say, get me your red, white, and blue Medicare card to make sure they have Part A and B to make sure they qualify for a Medicare supplement and a Medicare Advantage plan. They have to have that to get one of these policies. All right, let's talk about the pros and the cons of a Medicare supplement. So Medicare supplements, they cover the 20% gap or exposure of original Medicare. Their network is anywhere in the country. It's great for travel. It's 98% of doctors and hospitals across the country. You don't need referrals. So if your client likes to travel, my mom, for example, she likes to see family and friends all over the country, a Medicare supplement is the perfect plan for her. But if she didn't like to travel and she'd like to stay more local, maybe a Medicare Advantage would be a better plan for her. Some of the cons, they do have monthly premium. So when someone's aging into Medicare, they're going to pay about $100 a month, and the premium goes up typically every year, and they do get rate increases. Dental, vision, hearing, and Part D are not included in the plan. So I love talking about cross-selling. That is your easy cross-sell. I'm telling you guys, 90, maybe not 90, maybe probably like 80, 85% of the time, I am adding a dental, vision, hearing plan to that. Almost every single time, I add a drug plan to that. That is your easiest cross-sell right there, is someone with a Medicare supplement, add a dental, vision, hearing plan, and a drug plan. That's going to take your commission from just making a sale on that Medicare supplement to having 2 more cross sales. You now have 3 streams of residual income, and you're making about $1,000 on that sale. You do have underwriting as well with that. So you just know that if someone's over the age of 65, maybe they already have a Medicare supplement and you want to get them a lower rate, they're going to have to go through underwriting. So make sure that you take that into account when you're writing the policy. Just one note on dental, vision, hearing plans. This is how I say it, and it works. I'm telling you, it's so simple. I tell them after I write the Medicare supplement, I say, hey, most people get a dental, vision, hearing plan. That it's not a matter of if, it's when you're going to need dental help. Original Medicare doesn't cover it. 90% of people get it. Let's add that on. I say it like that. I want you to say it the same way. You're going to add that sale. And guys, you're going to make like $450 every time you do a dental, vision, hearing plan. So just say it. You're going to make the sale. You're going to get it. Now, speaking of sales techniques and how to sell these things, this is how I explain Medicare supplements to clients who already have one, or even if I'm just doing a little Medicare education. So Medicare supplements are standardized. That means that every Medicare supplement, the benefits are exactly the same. So if a client, this is what I say to people, I say, hey, if you see 2 orchards and they both have red delicious apples, and one is $1 and one is 50 cents, which one do you buy? I make the client say, I make them think, hey, if they both taste the same, get the one that has lower, that costs less. That's kind of how I sell Medicare supplements. So if I go into someone's house and they have company X, I'm not going to say any companies, but if they have company X and they have a plan G and they're paying $200 a month, and I have company Y and it's $120 a month, which one are you going to pick? One is $200, one is $120. Pick the one that has lower premium. It's that easy. So that's what I do. As I say, hey, apples to apples. Which one is more expensive? Which one's more expensive? Which one is less expensive? They taste the same. Which one are you going to buy? That's Medicare supplements. It's an apples to apples play. A few things I want you to take into account. We typically like to sell carriers that have brand name recognition, that have low rate increase history. So we'll make sure that in your area, we're going to get you contracted with carriers that are strong companies, they have a good rating with AM Best, they've got a great name, and they don't get big rate increases. So take that into account when you're writing these things too. Let's talk about these plans, right? They're all the same. There's only 3 plans that you really need to focus on. Plan F, Plan G, Plan N. There are a lot of plans, but let's narrow it in to these 3 plans. Plan F, let's go over that one first. It's not an option for people who are new to Medicare. They already have to have a Medicare supplement. A Plan F Medicare supplement. So if they have a Plan F, you can switch them to another Plan F. And I ask agents this all the time. What would make sense for you to switch them from their Plan F to another Plan F? Price. I do it all the time. If you see someone who, I'll give you a great example. I talked to someone who they had a monthly premium of like $350 on a Medicare supplement, Plan F, and I switched them to a different Plan F with $200 monthly premium. I saved them $150 a month. That's $1,800 a year. That's awesome. Our seniors are counting costs. That's what you can do with a Medicare supplement. Our other plan is Plan G. We sell mostly Plan G. It's this exact same as Plan F, but you have a deductible. It's only for certain situations at the doctor, and the deductible is $240 a year. It's not much. So what I'm doing when I see someone who has a Plan F, I'm either switching them to another Plan F or to a Plan G, and I explain the deductible. The other plan is Plan N. It's the lowest price one. I don't do as many of those. It's kind of similar to Plan G. They do have to pay the $240 deductible, and they have to pay a copay when they see the specialist and a copay when they go into the emergency room if they're admitted. So there are some little copays in that plan. I don't sell as much. Again, the premium is going to be the lowest on Plan N. My core is Plan G. I sell a lot of Plan G. I do sell some Plan F. But these are the three plans I want you guys to understand. Now let's look at all the plans. We put this sheet in here not to intimidate you. It's a lot of check marks. It's a lot of areas that your client has maybe exposure. This is here really not to intimidate you or to confuse you. It's really to make it easy that, look, don't look at all the plans. Don't look at plans A, B, C, D, K, L, M. Don't worry about those plans. If you see those plans, replace them in a heartbeat. That was probably, those people got into that plan by an agent who doesn't know what they're doing. The premiums are probably pretty high. Get them into one of those core plans, Plan F, G, or N. Let's look at it real quick. Plan F, if you look through that, it covers all the check marks. You know, it's going to cover if your client goes into the doctor, hospital, they get a procedure done, they pay nothing out of pocket. Plan G, we got one spot. It doesn't cover the Part B deductible, $240 a year. Plan N looks like Plan G, doesn't cover the Part B deductible, doesn't cover Part B excess charges. Part B excess charges are charges that doctors can charge over and above what the Medicare billing is. We don't really see that anymore. But again, we do have copays for if you go into the emergency room, $50, and we do have a little copay if you see the specialist. But let's make it simple. Your three plans, Plan F, G, and N. Forget about the other plans unless you see it, and you better replace that policy. So let's talk about just key expenditures on a Medicare supplement that you need to understand and to explain to your clients. So when we're turning 65, let's just understand this. Our Medicare supplement premium, depending on the state, is going to be about $100 to $150 a month. Their drug plan, it's going to be about $5 to $50 per month. Their dental, vision, hearing, make sure you add that plan to what you're selling. I'm telling you, it's so easy to sell. Just tell your client about it. They want it. It's one of the top plans our clients want. Dental, vision, hearing plan. Dental, vision, hearing plans. It's going to be about $50 to $75 a month. And also taking into account their Part B premium. So all these numbers seem really like a lot, right? But I want to tell you why it is not a lot. Because our clients a lot of times are coming off of a group policy where they might be paying maybe $2,000 a month. Or even I have a client that I just brought over to a Medicare supplement who for his wife and him, they're paying like $4,000 a month, and they had a deductible of like $5,000. What's the deductible on a Medicare supplement? It's $240. They also had a network of doctors and hospitals that they had to participate with. With a Medicare supplement, you can go to any doctor or hospital in the country that accepts Medicare, and that's like 98% of doctors and hospitals. So think about what you're offering somebody. A richer plan with lower cost and a way lower deductible. Most people coming off of a group, they're like, wow, I didn't realize that Medicare was so rich. Like, most people are like, thank you so much for what you're giving to me. I want you to understand this about Medicare supplements too. We're seeing premium all across the board here, right? I want you to think, who are the people who buy Medicare supplements? They are the people who have a little bit more income. We typically see Medicare Advantage for a little bit kind of lower to middle income, and Medicare Supplement middle to higher income. And we do see some variation in that. I have a client who makes a killer income, and for some reason they want a Medicare Advantage. I try to explain them, why not to do a Medicare Advantage plan, do a Med Sup. He's like, no, I want a Medicare Advantage plan. But just remember, Med Advantage typically to people who are just living on Social Security, Medicare Supplement to people who have higher income. That's how we're typically seeing it. We kind of kept this in a nutshell, guys. It's so simple. Medicare Supplements, they cover the 20% gap. It's that easy. There's a great cross-sell opportunity there. I didn't mention before that Medicare Supplements and Medicare Advantage, they only cover the first 100 days in the skilled nursing. That's an opportunity to talk about long-term care insurance, maybe an annuity that has some living, some benefits like a long-term care policy in there might work. But I gave you the crux of Medicare Supplements. Make your connections. Offer this product. Remember, it's more of a product for maybe more of a middle, higher income play. The next thing I want to tell you guys is we have relationships, kind of strategic relationships with certain carriers that we want to show you that they have bonuses, that every time you sell one, you make a nice bonus. And we have lead programs that are connected to certain carriers. So reach out. We want to show you which carriers to sell, which carriers have bonuses and leads, and we want to show you how to add this product to your product offering because it is so easy to sell. And I'll tell you this last thing. Be the agent that sells it all. Don't pigeonhole yourself into one side, Medicare Supplements or Medicare Advantage, because you want to be the person in your community that does the full scope of Medicare, not just one side. And I'll tell you, there's so many agents out there that have no clue how to sell Medicare Supplements, and hopefully you saw it today. It's not hard.